Welcome, everyone. We are so lucky to attend future Dr. Brendlinger's final presentation. Stephen is a PharmD candidate of 2026 at Roseman University, so he's in his final year, and we're only months away from Stephen becoming a pharmacist. It's so exciting. He's currently working with Rise Informatics in an advanced pharmacist intern capacity on high-impact informatics projects. And you're going to see some of that work here today. So Stephen has really excelled in bringing together his clinical knowledge and informatics expertise, and just always consistently shows a talent for thinking beyond the data to design, to really create technologies and concepts and innovations that empower caregivers to focus on the human side of healthcare. I'll hand it off to you, Stephen, to present on just that.
Thank you so much. Thank you, everyone, for joining. I'm excited to talk about this passion project. As Megan said, I really love to foster human connection, and I'm excited to try and incorporate that into healthcare as maximally as possible. So today we're going to be talking about empowering patients through pharmacy services and digital health solutions. We're ultimately going to discuss the intersection of access, chronic disease management, and patient stories to go from chart to connections. So for the presentation overview, we're going to focus on patient access barriers in chronic disease management, the human story lost in electronic health records, ambulatory care pharmacy's unique value in this position, and technology solutions that enhance human connection, and my personal favorite, the About Me section vision, which is going to foster patient-centered care. So what I really want to come about from this presentation is to be able to identify critical gaps between clinical data and patient stories and evaluate EHR limitations in capturing patient humanity. I really want to foster designing patient-centered informatics solutions and understanding ambulatory pharmacist roles in personalized care, and really envision the future of human-driven healthcare technology. So we really want to bridge technology and the human connection for patient futures, such as like needing energy to finish the school year for a teacher, or that someone's biggest goal is to walk their daughter down the aisle. These are the moments that give meaning to the work we do, but they're really hard or not typically apparent within a chart. So the overall question we're going to discuss is, how can we transform electronic health records from data repositories into bridges for human connection? And so we're going to start off with the healthcare disconnect. So to really set the scene, typically when you walk into a clinic or a hospital, you see the same story. It's typically a patient sitting like across from a caregiver, unfortunately separated by a computer while the caregiver documents. I have unfortunately partaken in this activity during my rotations, and it's a habit I'm trying to break. But overall, the EHR is everywhere, quietly recording vitals, labs, and prescriptions, but not typically capturing what makes a person who they are. Across America, we have 129 million patients with chronic diseases, 50% of whom are typically non-adherent. And this is where we can possibly see patient-centered care take a role in for like lowering that number. On average, a physician is only able to spend 15 minutes of appointment time with a patient, and then 75% of their time is spent in an EHR. So we're capturing things like vital signs and lab values, diagnosis codes and procedures, or medication lists and allergies, insurance and billing info, and then just documenting clinical requirements. But we're missing out on patients' personal goals and motivators, or their hobbies and interests that bring them joy, which could affect their quality of care, or family relationships and responsibilities that would really foster a supportive environment, and cultural values and preferences that could play a role in choosing a medication, or life experiences that are overall shaping their health-based decisions. With rapid technology advancements in healthcare and emphasis on quantity versus quality, we've really created a disconnect. And so what if we started approaching these technologies as a tool to reconnect with patients? From collecting informative data to using it as a patient connection tool, there's a lot of potential for positive change here. And so we have the vision, which is an About Me section. So imagine opening a patient's record and finding a section called the About Me. In it, we have the patient or caregivers that share details that make the patient feel seen, like their hobbies, joys, goals, what matters most to them. The chart kind of becomes more of a diagnosis tool. It's really bridging connection with the patient. So a good example of this is for our fictional patient, Margaret Thompson, who is a 67-year-old female. So she answered these series of questions such as, what brings me joy? She said that teaching her 8-year-old grandson, Jake, how to play pickleball every Saturday morning. And he's getting really good. She expressed a lot of enthusiasm about this. She said her current goals are to have enough energy and stability to keep up with Jake, and then maybe even enter a mixed age tournament together. And she would love the caregiver to know that she's a retired elementary school teacher and learns best when things are explained step by step. And she likes to write things down. She also would like you to know that she lives alone with Jake, but visits every weekend. And then her biggest worry is that her arthritis and balance issues will keep her from being an active grandma. And so there's a lot of benefits in this scenario where we learn this info about a patient. They typically feel seen and then heard as a whole person and really share meaningful context for treatment decisions. It connects their goals with their life priorities and fosters stronger relationships with their healthcare team, really creating more trust. And then it just reduces that feeling of being just another patient in an office. There also are provider benefits here, so they understand patient motivation and context and personalized treatment recommendations and connect medical goals to their life goals. We could potentially reduce provider burnout through meaningful connection with patients and improve medication adherence and outcomes through relevance, or decrease the proportion of appointments missed. Patients could feel excited to come to their appointments, which would be amazing. But yeah, overall, we just really want to transform the chart into incorporating connection points. And so in our next slide, we have some visuals. So this is what kind of a possible EHR could look like. You could see the About Me tab in the top. And then under that, they have generalized categories that appear every time that that section is opened, such as diet restrictions, where when you click on it, it'll show that they have gluten intolerance or food texture sensitivities. This is really important information to know for patients who need diet recommendations for diabetes management. Or there's things like gait difficulty, such as diabetic neuropathy in their feet, that could play a role in how we approach maximizing their stability or ability to walk. And then things like religious preferences. So typically with religion, there's a lot of fasting periods. And so that could play a role too on medications that need to be taken with food. So we'd have general concepts there, and then the last updated feature with the date and time updated by whom and their credentials. In this world, I would love to see it be like PharmD candidates or PharmD members, providers. It could even be like front desk personnel, anybody who's able to input that information for the sake of the patient, if not themselves. But they'd be asked questions along their goals, what matters most to them, what they feel may be some barriers, what their lifestyle's like. And then that would really play a role in their care. And if it's someone else other than the patient's entering that in, there are options for the need help section, as you can kind of see there, that would have some suggestions for questions to ask to kind of obtain that information. And so here's another visual opportunity where you kind of see more of just like a traditional documentation style. But once this information is presented and documented, this is where we see kind of that foster of technology too, where we can have an AI analysis that interprets things and provides insights. And then the pharmacist can review and provide guidance. And then the patient can receive positive treatment that they feel a connection to and have improved health outcomes, which of course is ideal. And then our hidden solution here, I think ambulatory care pharmacy can really play an essential role in this part. Patients typically don't know that ambulatory care pharmacists complete medication reviews and have one-on-one consultations that are around 45 to 60 minutes, which is significant in comparison to the provider time of 15 minutes that we traditionally see. They also offer medication therapy management services and our disease state expertise. They have humongous insight on patient assistance program. I can't advocate for that enough. I am grateful for my care pharmacist for that reason. And then they also work collaboratively with physicians, which I think a lot of patients misinterpret or are unaware of, which is essential because it's a care team, not a care personnel. And then we also have services in an care setting, such as Medicare Part D MTM programs, or health plan pharmacy services, clinic-based ambulatory pharmacy, or telehealth pharmacy consultations, both via like video chat or phone. and then community pharmacy clinical services, and have connections to specialty pharmacy coordination. And so really, ambulatory pharmacists are kind of an unutilized resource for patient connection with all the level of services that they offer. But there's a lot of evidence-based impact with them. They improve clinical outcomes such as A1C modification or LDL lowering, blood pressure stabilization. Overall, there's an increased number of patient within goal parameters when they work with an ambulatory care pharmacist, especially within MTM services. They have a 20 to 40% improvement in medication adherence or a 15 to 25% reduction in hospital readmissions, which is awesome. And then secondarily, through those, you get cost savings and enhanced patient satisfaction due to all the different circumstances that are being improved. But it also reduces provider burden when it's in the ambulatory care setting due to the decreased amount of time. It's also been shown that they have decreased adverse events and an overall improvement in patient knowledge, medication adherence, and quality of life. And so with this and the scenario here, when the pharmacist learned that Margaret wants to play pickleball with her grandson, it wasn't just about balanced medication, preventing falls. It was about preserving Saturday morning time and memories with her grandson. And that changed everything about how we approach her therapy, which I think really humanizes the level of care. And so technology solutions that enhance connections. Sorry, Megan, do you mind going to the next slide? Thank you. So there's a lot of evidence about AI-supported medication adherence. In 2025, there was a study that demonstrated how AI-enhanced pharmacy interventions achieved around a 6 to 8% improvement in medication adherence across chronic diseases, and also showed significant clinical and economic benefits, which is really key to combining technology efficiency with human connection. There is a lot of technology implementation that increases outreach, flexibility, and engagement in combination or an adjunct to in-person visits. And it allows for the ability to reach more vulnerable patient groups and improve access for patients with transportation, parking, or cost barriers to in-clinic visits. And so I have listed some patient-facing tools that could be utilized, but don't typically replace the human aspect of direct care also. So there's the pill pack, which is exclusive with Amazon Pharmacy. It actually places meds into a daily packet in a roll that is for a 30-day supply, and also has automatic refills every 30 days. It is, however, only available in English and is not child resistant. So there are some safety concerns there if you live in a household with very young children. There is the DoseCast app, which is scheduled reminders for medications and includes pictures, strengths, and alerts on meds running low. There's some concern there for alert fatigue for frequent or as needed medications. There is the MediSafe dose calendar and tracking, which also allows the incorporation of family members. So you can incorporate your support system, which I think is phenomenal. And then it also has monitoring parameters or tracking for things like weight, blood sugars, blood pressure, cholesterol, oxygen saturation. And some of this is even integrated through Apple Health. And then it also has drug interaction warnings. And then just in my brain, when I read that, I thought there could be some problems for medications when tolerance is built up, or if the provider is just having proper monitoring in place. But it does have refill and appointment reminders, which I think is really cool too. There is Patient Partner, which is an electronic mentorship with relatable mentors who have undergone similar healthcare journeys. So building on that support system if you don't have a close one at home or a wide network there. But overall, in general, most apps are just reminders for medication administration, have complex navigation, small font sizes, or lack task report support. So we'd really love to see improvements on there and maybe even just more integration into human-centered care. But some integration platform potentials for technology solutions would be an EHR About Me section modules. Of course, I'm going to plug in my little design there. The patient portal goal tracking, pharmacist workflow integrations, provider communication tools, outcome measurement dashboards, even quality improvement analytics. So in general, for AI enhancements, which we have a huge potential for, there's a lot of barriers in healthcare that are modifiable, and technology can just act as that investigator or offer an appropriate solution. And it really promotes patient engagement, limits complications and hospitalizations, lowers healthcare costs, and can reduce medication error, which is important for patient safety. So to further that conversation, AI-powered solutions can play a role in predictive adherence modeling, personalized intervention recommendations. Risk stratification algorithms are a huge potential. Natural language processing, automated care gap identification, or goal-aligned therapy optimization. So really, we would see an invitation here for patients to input information, and then there could be that AI integration and then an application for clinical use. And so the AI enhanced About Me integration, I have a beautiful example here where it identifies that the patient goal is that they want to teach their grandson pickleball. The AI analysis identifies balanced medications, does a fall risk assessment, and recommends activity-related therapy goals. And then the pharmacist can personalize things such as the medication timing, education, and then do a follow-up around the pickleball schedule, which with this personalized goal connection, we would see about a 47% higher adherence rate. So we would see significant improvements there, which I think is important. And so for the About Me app technical implementation, could it be its own app? This would be kind of cool if we could have its own app that just integrates into an existing EHR system, which would then help patients voice their stories and update their goals and connect with their health journeys to what matters most in their lives. With this, we would see maybe an email that would say something along the lines of, "Hi, Margaret, before your appointment with Dr. Smith next week, we'd love to learn a little bit more about you as a person. Please take 5 minutes to tell us about your hobbies, goals, and what matters most to you." This helps us provide more personalized care. And so they would lead to that link and then be prompted to answer a series of questions that would be integrated into their electronic health record, which I think is cool. There also could be a QR code so they could scan it at registration and update it, or portal integration. Maybe they go into their MyChart and it's input there, but integrated still in the EHR system. Maybe even voice recording for patients with low literacy or inability with like visual impairments. There could be family access for caregivers for patients who, again, are physically not able to enter that information, or general automated reminders to update this quarterly or biannually. Now, there would be some concerns for privacy and security that would need to be taken into place. We obviously would need to be HIPAA compliant. I think it would be important for patients to remain in control and they can share this information with specific providers. The patients would need to own and control their stories and then track who has access to their personal information in relation to this, because it's not pertinent necessarily to their health, but definitely helpful. And then I think they should also have the right to remove or modify the content anytime, especially since we're asking them to update it regularly, but keeping those general categories there. And so this would really enhance patient engagement through features like the voice-to-text patient stories or goal tracking and updating, family input. There could be provider alerts, so that way they're staying informed, or the MyChart integration to hopefully create less of a burden for the care team as well. And so the educational vision here is really to teach human-centered care. We want caregivers to learn what matters most to you for a patient instead of asking, are you taking your medications? We want them to discover that pharmacy or healthcare in general is ultimately about understanding and serving a human based on their story and lifeline, not just dispensing medications or diagnosing them. So we could see some curriculum integration here, teaching techniques such like patient interviewing with the About Me focus, or cultural competency and personal goal assessments, practicing compassionate care and shared decision-making, or motivational interviewing techniques, and then just using technology to really enhance patient engagement, using it as a teaching tool. With this, we can have simulation scenarios such as Margaret, the pickleball grandma. We love Margaret. A teacher managing diabetes while working, a father wanting to walk his daughter down the aisle. There's endless scenarios that really play a role here. And then there are assessment methods we could use, like patient story documenting quality, goal-aligned therapy recommendations, empathy, or communication effectiveness, or technology integration, and then just burnout prevention skill development. And then our real focus here is the 5 C's of human-centered pharmacy. So we have building genuine connection and relationships with patients, understanding their life circumstances, so the context around their decision-making, working collaboratively with them to set meaningful goals, making sure we're using technology to enhance and not replace the human interaction, and just practicing compassion through empathy while preventing burnout. This would help both the next generation of healthcare workers as well as future generation of patients. And so addressing burnout through the human connection, we have the burnout paradox, where providers often say that their contributor to burnout is just a lack of meaningful connection to patients. Where we see the system fails is that our technology is not really designed to create that connection. It actually kind of puts distance there. So I'd love to see the switch there. And I feel like the About Me section could really have a part in that solution. And a big driver of this is that 76% of physicians report experiencing burnout and 61% of pharmacists report work stress. Overall, 45% of time is typically spent in the EHR documentation and 15% is spent with direct patient interaction. So we want to shift those numbers to a more favorable aspect for patients. And so some of those burnout contributors we see are excessive administrative burdens, such as lack of meaningful patient relationships. There's a lot of time pressures and productivity demands. So again, that quantity over quality aspect. The technology that really distances us from patients and feeling like a data entry clerk. I came across that exact comment so many times. And then just the inability to provide ideal care. So kind of going in that automatic workflow. The About Me really can kind of act as an antidote here, where it would remind providers why they entered healthcare and creates that emotional investment in patient outcomes. There's a lot of context that makes the work meaningful and enables personalized care delivery. We would really strengthen that provider-patient relationship and build trust, which would further advance the level of healthcare that we can provide to patients. And it could transform everything into a purpose-driven care. And so for the provider reflection, another statement here would be something along the lines of when I learned that Mrs. Johnson's goal was to bake cookies with her granddaughter despite her arthritis, managing her pain medication wasn't about numbers anymore. It was about preserving precious family traditions. And I can put a lot of value in that, having experience with baking cookies with my grandma growing up endlessly. And so I value those connections and really put that into my practice of pharmacy as well. And so we have the future of human-driven healthcare. The ultimate vision we want to see going forth is a healthcare system where technology amplifies human connection rather than replacing it. And then patient stories can drive clinical decisions, and every interaction strengthens the therapeutic relationship rather than just documenting it to death. I think that is important. We want technology to serve humanity, not the other way around. The future of healthcare isn't about choosing between high tech and high touch. It's about creating high tech that enables higher touch care. And so the future appointment could kind of look something like Dr. Chen opening Margaret's chart and seeing her updated goal that she wants to teach her grandson the pickleball serve she learned. And AI can really highlight her current medication support this goal and suggest optimizations for morning energy and reminds the doctor about Margaret's preferred learning style. The conversation will start with celebrating their progress towards what matters to Margaret, not reviewing the lab values. I think that is essential. And the technology can really serve an important role here of learning patient values and preferences, create those predictive analytics for goal achievement, and an automated administrative tasks. So that way it's less time spent doing administrative tasks. There could be real-time patient story updates, seamless care team communication, and outcome tracking that matters to patients and providers. So we would really lead with humanity so that patients are known by their story and not just by their diagnoses. Their goals would reflect their values, and providers would be energized by these connections. They would allow for engagement in care as partners, as well as incorporating their support system as engaged care partners. Communities supporting health together and joy and purpose in healthcare would be incorporated again. So with this, there are some leadership imperatives. We would need to allocate resources for relationship building technology and include patient story engagement and quality metrics. We would want to develop a curriculum that prioritizes empathy alongside efficiency and creates workflows that energize rather than drain providers. We would ultimately be able to use technology to personalize the care at a population level, which I think is a hopeful future that I really, really love to invest in. And so in conclusion, have a full circle moment here when Margaret successfully taught her grandson the pickleball serve at their tournament. It wasn't a personal victory. It was proof that healthcare could honor what mattered to the patient while achieving clinical outcomes and clinical outcomes that matter most to their providers. And so what we learn, hopefully, from this is that patient stories are missing from charts and ambulatory care pharmacists have time for connection, and hopefully we can incorporate a future where other healthcare providers also have time for that level of connection. Technology can really enhance rather than hinder relationships and improve healthcare. Provider burnout was a link to lack of meaningful work, and simple changes can have a profound impact on that. We want patients to be seen as whole people, and they also want that. So some of our next steps could be implementing the About Me feature. Yep, let's do it. We could train staff to ask about patient goals, advocate for EHR enhancements, measure clinical and human outcomes, and share stories of successful connections. We really want to hone in on that human-centered care design here. The healthcare transformation isn't just about like new technology. It's about remembering that behind every medical record is a human being that has dreams and fears and goals that should be known and honored and supported by their healthcare team. With this, they can make a more patient-informed decision on both inpatient and outpatient environments. It can foster patient connection, increasing the likelihood of successful outcomes and preventing healthcare burnout. There's many, many wins in this scenario here. So just to sum everything up with our overall goal, it's just to create a healthcare system where technology serves the relationship between caregiver and patient, with every chart telling not just the story of the disease, but the story of the person behind it. And to really provoke some human stories back into healthcare and how we can incorporate technology to serve that, I would like to ask some thought-provoking questions. How do you see the About Me feature or information itself playing a role in an inpatient care setting versus outpatient?
Good question. And real quick, just great presentation, just absolutely phenomenal. So thought-provoking. Gosh, what a good question. How do you see the About Me feature or information playing a role in inpatient care specifically? So just to kind of jump in here, I really liked the concept of how knowing more about the patient personally can absolutely impact and create momentum for that patient in their care plan to be personalized in a way that it is meaningful to them. Because exercising, we all know, like in America, we struggle as a population with obesity, cardiovascular health, and so many things related to where exercise could help, but everyone has that goal to exercise more, right?
And that's so differently for each person.
Yeah, so this feels game changing, where it's how can we really transform what that exercise means or why they're exercising and why we all should exercise. And I think that that's so transformative. So in an inpatient care setting, I think even having more information about the patient could lead to their caregiver also becoming more engaged personally also, and keep that patient safe. We all know there are quite a bit of medical errors that happen in healthcare, and a lot of it, when you interview these caregivers that have been involved in those errors, it's I didn't realize that happened. Like there's a lot of not realizing or not seeing the error happen when it's right in front of you. And a lot of that is because our workflows automate a lot of the care we provide. So having something like this would be really interesting to see if we could flip the caregiver out of that mode also. So though there's intensive meaning for patients, I think the caregiver meeting, like you were talking about, is really interesting to get into of how that could be.
It's such like a double-edged sword in a positive way is kind of my thought process behind it. Like between provider and patient, there's just so many benefits for both. And some of my thought process, even in the inpatient care setting, is probably more so in the critical care, when a patient is not able to make decisions for themselves and the provider has to make the call. I think this gives the opportunity to make the most informed decision as well, not just for a clinical aspect, but for a recovery aspect even. Kind of learning patient motivators. I think that would play such an essential role in a patient's recovery process once they get to a point where they see what decision was made for them on their behalf.
Yeah, I like that. I think just to add to that, I think too, especially because outpatient, I mean, you can follow up with that person and ask them how those goals are going and how they're feeling about their care. You kind of get to, you know, see how those goals are developing and if your treatment plans and your ideas are really making an impact. But I think like inpatient too, you brought up like the level of burnout and how stressed people feel in their roles. And I just think, as like from a provider perspective too, of, and Meg had already touched on maybe avoiding some of those safety errors and things that might happen, but from a provider perspective, I think like this could really impact like the level of burnout too. Like imagine getting to go to your job and be like, oh, I got to go see Samantha today, I got to go interact with her, I got to help her, because you do start to have like that connection with that person. You understand where they're coming from. And I think just, I love this idea because I think it really humanizes people when we are in kind of a system that I think takes that away a little bit.
Yeah.
And I think just even bringing that, it would just bring so much more fulfillment and so much more joy in our careers and our jobs, despite them being busy and chaotic. So I think that it benefits both patients and like it also benefits providers, like you said. So I think that's what it makes me think of, especially that inpatient when you're with them a lot more.
And it can even have that interdisciplinary approach where physical therapy or occupational therapy, or you incorporate an ophthalmologist, like it could play such a role in so many different disciplines within healthcare. And I think the universal aspect of that is kind of beautiful in retrospect to the patient. I am very patient-centered, and I love how this puts the focus back onto the patient rather than the technology, rather than the clinical values, which, yes, are all important and play a major role, but they're kind of starting to take over the humanized aspect of care. And I see that's where, like you said, we see the burnout. And to bring that back, I think with our technological advancements, we need to start kind of putting some focus there to kind of find balance. I think that's really important. And those are very beautiful responses. To kind of go full circle here, I'll ask one more question, then I'll open up to questions for y'all. How do you think we should train the next generation to embrace human connection level of care? What are some ways that you see that kind of needing to be implemented?
I mean,
It's a tough question.
It is super tough. I think one thing, I think as pharmacists and like the type of curriculum that we have, we're very data driven. We're very like analytical and into like cause and effect type relationships and things like that. And I think it would be really cool to be able to have studies and data of how this has impacted pharmacists' career and how it's impacted their joy in their job. So I think just being able to like see that and like what the outcome has been for other people would be super impactful. And then I also think just like really giving students opportunities and examples to practice this as well. So being on rotations where the school knows that that's really being emphasized, and learning how to use those tools, learning all the capabilities that these tools have, so that as a student, I think you go on so many rotations with so many different people and you learn how to do so many different things and how one person tackles this issue versus another person tackles that same issue. So I think it would be cool to have lots of different perspectives of how to tackle that about me section as well, to then be able to eventually develop your own spin on it where you feel like you can use it to the best of your capabilities. I think those are two really powerful things that could be super impactful. Looking at it as like a recent grad, like what would have helped me as a student. I think both of those things would have been helpful for me.
Yeah, that's a great answer. And I mean, even me being in school right now, rounding out my PharmD, I feel like I would love to see like a simulation aspect, or kind of be given scenarios and how you would handle that approach. Because I feel like we get taught so much directly from books. I would love to kind of see more of the clinical incorporation there, because for testing purposes in our licensing, yes, we need to know the book level of knowledge, but also that's not necessarily always the case for clinical scenarios. And so I'd love to kind of see some incorporation of a clinical course maybe, or yeah, I just would love to see that, to be able to know how to handle approach with human-centered care. I think that would be beautiful.
Oh, I like what you both said. That's so meaningful. And y'all know that I'm biased, because you probably can anticipate the answer I'm gonna have, because think about this presentation and what type of learning experience this came from. This human connection to care idea came from an informatics rotation. And I don't think people often connect those two, because often we teach pharmacists how to communicate medication information. But you're right, what is the simulation aspect of that? Often we teach PharmD students drug information and how to use that in care. But there often seems to be this little bit of a gap, because the way care is done is so technology heavy. And so informatics is such an interesting professional skill that I feel like I wish we could embed in every pharmacist, because whether or not you're an informatics pharmacist, informatics skills are so important, because understanding what the technology is and is not doing in a patient's care journey can help you really connect in with the actual patient, because there is a real phenomenon where caregivers can't differentiate between the e-patient, like the version of the patient that's represented in the EHR, the data, the algorithms, the lab values, versus the actual human being sitting across from them. And so what happens is you really do risk reducing care to a series of clicks and checkboxes. And how often do we talk about that on my learning experience here in informatics? And so informatics education really helps flip the script, where future pharmacists can really develop a level of discernment of how do you recognize where AI, EHRs, clinical decision support tools add value, but how do you not lose your own critical thinking? You know where those tools fall short, and you're able to step out from behind the screen to connect with patients on a personal level. And that's where I feel like this idea is so, I like that you use the word beautiful many times during this presentation, because it is absolutely beautiful, of this type of technology enhancement, how it could help truly humanize care, get people to kind of, you almost have to pull people out of the simulation a little bit of like, okay, you're in the room with the actual patient. How can we do this? So this type of tool where you're collecting that patient voice goals, folding it into the patient's care, bridges technology and humanity, and like pushes you towards that humanity direction in such an incredible way. So in this way, it feels like this creates a moment where data supports but does not replace connection, but actually encourages it. And what a powerful idea, Stephen. I am so impressed by this idea. So excited about what's next here.
No, and a lot of it too, I'm hoping kind of secondarily, it will really, I'm sure there'll be an element of a shock to some patients who have unfortunately not experienced patient-centered care and have felt like a number, especially minority groups who have the unfortunate reality of being mistreated or misdiagnosed or prevented from a diagnosis. Like, this would really kind of build that connection and level of trust for them with healthcare again, so people feel more comfortable seeking care. I think in a beautiful world, I would love to see this foster that and help that grow. I think it would take time, but we got to start somewhere. That's my mindset, and I think this is a good start to that journey.
I love that.
But are there any? Sorry, go ahead.
Oh, I was gonna say, I know you challenged us to come up with some questions, but yes, gosh, we've got some really good ones here. So I might steal that first one. So how can we measure the impact of human connection? What a powerful question. I do really would love to dive in there and get your perspective, because how do you measure human connection? But we are in a world where we are measuring everything. It's so important to keep momentum, to keep something funded, to keep something focused on. So I'm curious, what are your thoughts there?
So of course, there's like satisfaction surveys, like service level, on a deeper level to measure the impact of this being incorporated in a healthcare setting. To me, measuring the impact and success would mean having improved outcomes, improved like A1C control, or people measuring their quality of care. I think that's where I would hope to see the impacts take place and where I'd love to see that measured at a deeper level, of course, because then everybody wants to improve their quality. And so you're going to have those little exit surveys that most places have. But I'd love to see studies that measure that level of impact of adherence or production or reduction in hospitalizations and things like that.
I love that. So it's almost like progress towards that goal. Like, yes, we've made that goal more positive and meaningful to the patient, but you know what? There are very hard data values of, are we making it towards that goal, like laboratory wise as well, is such a good thought. I also like the idea of, you mentioned in your presentation, like the impact of clinician well-being this could have on burnout prevention, compassion fatigue prevention, or recovery. And so there are a lot of different metrics out there for how to measure that or fuel gauges for that. So it'd be cool to see, is this a factor in helping move the needle on those too? Like, what's the impact to our providers? I love that. What a powerful question.
It's a thought-provoking one, that's for sure.
Yeah.
But cool. Are there any other questions, possibly?
I think one of my questions I was curious on, and I know you kind of briefly talked about this, but just like it already is kind of chaotic workflow that all healthcare professionals are in, right? And I know you talked about the benefit that it could have for healthcare professionals. But I think one of my questions is like, if this was to be implemented, how would you, and what would you focus on, I guess, if you were like training healthcare professionals to use this? What would be like your key points that you would share with them and things that you would also teach to avoid potential pitfalls in using the About Me?
That's a really good question. And this, like you said, this kind of goes along with the educational aspect of maybe giving an example to help the fellow caregivers understand the why behind the action itself of incorporating this and implementing it as a tactic to approach patient care. And it can be used as a connection tool beyond the MD. This could be used for front desk personnel. They usually get the most chatting when a patient comes up to them and checks in for their appointment. And so it can really kind of foster in any environment that level of connection with a patient. What I would also love to see incorporated is the support for patients who take the time to answer it prior to coming into their appointment, because that ultimately alleviates the responsibility being put on the healthcare personnel, but just also really allows for direct patient expression of their response. And again, kind of allowing the patient to play a role in controlling some aspect of their healthcare. I think that's a big, scary world for a lot of patients. There's a lot of fears around approaching healthcare and participating in it. And I think giving them a level of control would also foster their ability to reach out for help and be vulnerable in those situations. So there's a lot of purpose behind it that I think would need to be expressed to those who are a little resistant to it. But I feel as though with the added potential to it and the perks, I would hope there would be limited kickback, if any. Does that answer your question? It was kind of a complex answer.
No, that's great. I love that.
Okay.
I love that too. Well, and I have a question. I know we're starting to run into time, so this might be the last question unless there's some quicker ones out there. But Stephen, I just want to give you the opportunity to talk about like, how did this idea click into place? Like what inspired you here? Like, what was it that you were seeing both in your care experience, or I just want to hear how did this click and what inspired this?
Yeah, no, that's a really good question too. I've naturally always been more patient driven. I thrive off of human connection in my personal and professional life. I've worked in holistic healthcare, which really kind of fostered my level of appreciation for getting to know a patient and expressing compassion to them, and how that can really advance our level of care. As far as the creativity behind implementation, I really have to give credit to ambulatory care pharmacy. Being able to spend that one-on-one time with a patient and understanding how much they aren't educated or limited health literacy, like this could really foster that as well as make connections to it. Like I had a patient who was resistant to diabetes and needed a little extra explanation behind it and how it's different for each person depending on the level of severity for insulin resistance. So their medication regimen will look different from another person's, and reasoning behind their A1C control and how we can implement personalized exercise goals. Like I had patients who would work out and eat decent and just needed something as small as a diet change for sauces, so a sugar-free sauce to get them to their A1C control, or an elderly person with limited mobility safely using her walker to walk back and forth in her house to get a little bit of exercise. That would help her get her blood sugars a little stabilized as well. So it's just, I found the little minor details really make a huge difference in care, but those are the things that often get missed or are really hard to find within their chart. I mean, working in a huge hospital here and over the Intermountain, sometimes the notes section of a chart is also really hard to dig through and find the appropriate information. And then you're kind of spending too much time in that front. And so I also wanted it to be accessible easily. And then, yeah, just fostering the connection between patient, provider, practicing patient autonomy, and then realizing how much it would prevent burnout also was kind of eye-opening in my research, and really loved that aspect of it. So I think I'm really excited about potential here, and I hope whoever watches this can really incorporate that into their care as well.
Yeah, I that's incredible inspiration, Stephen. And what's really cool, what you just said, is there's so many different levels that someone can take this information and incorporate it into their day-to-day almost instantly. Like, is it a little dot phrase that they add to their note, or is it like there are some immediately implementable factors to this, though there is a really cool formal piece to it of how would you design this overall. Like, what a beautiful idea that is so beyond accessible for people to really have a takeaway that they can humanize their care right now. Incredible. I did want to say, I love that story of how ambulatory care experiences really shaped your vision here as well. And ambulatory care pharmacists and pharmacists play an incredible role in helping make patient care more connected to that patient. I love that thought. I did want to flash up your resources here, because you did a lot of work of making sure this is a highly referenced, highly research supported presentation. And we'll close because I know we're coming up on time. But what excites me most is just seeing how incredible it is you connected that patient-centered vision with how do you apply or implement an idea or grow an idea. And I feel like that's where I'm seeing your informatics and innovation expertise really grow here within this learning experience. And so I get really excited for, you give a pharmacist just a small crash course in informatics, and all of a sudden you have like a software really that could transform healthcare right in front of you. So yes. I think this is incredible what you've designed here. I think this is really going to light up human connection, rather than what we see with a lot of EHR/patient interactions right now, where it's almost like a replaced piece of medicine where we have technology replacing care. And I think this returns us right back. So Stephen, I am so excited. I have no doubt you're going to carry this mindset, this idea throughout your career and grow it. And I can't wait to see where this goes and how people incorporate it. Incredible job. And I just have absolutely loved having you here at Rise Informatics. I just can't wait to see where you go. So we'll close the presentation and stop the recording. And thank you everyone for coming.
Thank you, y'all.